Hello, my name is Zach, and today I'm going to be talking about blood pressure. I will explain what blood pressure is and how to properly measure it, explain the healthy ranges of blood pressure, talk about causes, complications, and treatments of hypertension, and give some tips on how to lower your blood pressure and keep it within a healthy range. This video was done as a part of a service learning project for Oakton Community College. So what exactly is blood pressure? Firstly, the heart acts as a pump that generates blood flow, circulating the blood throughout your body through blood vessels. This allows your body's tissues and cells to receive the oxygen and nutrients that they need. The force that this flowing blood exerts on the walls of your arteries is what's known as blood pressure. High blood pressure, or hypertension, occurs when this pressure is too high. As you may have seen before, blood pressure is measured with two numbers. The first, or top number, measures systolic blood pressure. This is the pressure exerted on the artery walls when the heart beats, or when the left ventricle contracts and ejects the blood into the aorta. This number will always be higher. The second, or bottom number, measures diastolic blood pressure. Unlike systolic blood pressure, diastolic blood pressure measures the pressure exerted on the artery walls when the heart rests between beats, or when the semilunar valves, the valves that open when blood is ejected from the heart, close. The diastolic blood pressure measurement will always be a lower number than the systolic blood pressure. Now let's talk about what the normal blood pressure ranges are. It's important to note that these ranges refer to a person's blood pressure at rest, which is ideally when blood pressure should be measured, as it's normal for blood pressure to rise after exercise or when experiencing intense stress, anxiety, or pain. Ideal or normal blood pressure is less than 120/80. Elevated blood pressure is when the systolic pressure is from 120 to 129 and the diastolic is less than 80. Hypertension stage 1 is when systolic pressure is between 130 to 139, or diastolic pressure is between 80 to 89. Hypertension stage 2 is when the systolic pressure is 140 or higher, or diastolic is 90 or higher. And finally, a hypertensive crisis is defined as having a systolic pressure of higher than 180 and or a diastolic pressure higher than 120. In the event of a hypertensive crisis, you should seek medical attention immediately. Hypertension can be split into two different categories: primary hypertension, also known as essential hypertension, and secondary hypertension, and there are many potential risk factors for developing them. Primary hypertension tends to develop slowly over a period of many years, and there may not necessarily be an identifiable cause. However, some of the risk factors for developing it include having a family history of hypertension, being overweight or obese, having a sedentary lifestyle, excess alcohol intake, high salt intake, low potassium intake, smoking, aging, and stress. Secondary hypertension, on the other hand, tends to develop abruptly, and there is usually some kind of underlying cause or condition. Some examples of causes of secondary hypertension are obstructive sleep apnea, kidney disease, adrenal gland tumors, thyroid problems, congenital blood vessel defects, certain medications, and illegal drugs such as amphetamine or cocaine. While high blood pressure can have serious health consequences if left untreated, people with high blood pressure oftentimes actually show few or no symptoms. When symptoms do occur, some examples include headaches, shortness of breath, fatigue, irregular heartbeat, chest pain, bloody urine, or nosebleeds. However, these symptoms aren't very specific and can be symptoms of multiple different conditions. They also often don't occur until the hypertension has reached severe or even life-threatening levels. This is why it's important to see your doctor regularly and have your blood pressure taken as a part of your routine checkup. After the age of 18, people should have their blood pressure checked at least every 2 years. In the case of people 40 years and older, or people who are at high risk for hypertension, a blood pressure reading should be obtained yearly. Some treatments for hypertension include lifestyle changes, medications, or a mix of both. In milder cases, your doctor may suggest you start by changing your lifestyle, such as by exercising more regularly, losing weight if necessary, limiting alcohol intake, and eating a healthier diet with less salt. If medication is necessary, doctors may often prescribe more than one, and it can take some trial and error to find a medication or a combination of medications that works for you. Some commonly used high blood pressure medications include diuretics, angiotensin-converting enzyme inhibitors, angiotensin II receptor blockers, and calcium channel blockers. If these medications are not effective, your doctor may also try alpha blockers, alpha-beta blockers, beta blockers, aldosterone antagonists, renin inhibitors, vasodilators, or central acting agents. If left untreated, hypertension can lead to severe health consequences, as over time it will cause damage to the blood vessels, causing them to narrow through the formation of atherosclerotic plaques, as well as cause damage to other organs. Some complications of high blood pressure can include heart attack, stroke, aneurysm, heart failure, weakened and narrowed blood vessels in the kidneys, thickened, narrowed, or torn blood vessels in the eyes, metabolic syndrome, trouble with memory or understanding, and dementia. While less common than hypertension, having a systolic reading lower than 90 or a diastolic reading lower than 60 is known as hypotension or low blood pressure. For many people, this isn't necessarily a problem if no harmful symptoms are present. Lower blood pressure can actually be a result of being a very physically fit athlete, for example. However, it can also point to some kind of underlying problem and may also be life-threatening, such as in the case of shock. Some symptoms of hypotension that may signal a problem include dizziness or lightheadedness, fainting, blurred or fading vision, nausea, fatigue, and lack of concentration.
Hello everyone, my name is Zach and I'm doing a project, a service learning project for a class at Oakton Community College that involves talking about blood pressure, informing people on what it is, and also on how to take blood pressure. So in this video, I'm going to be taking a manual blood pressure. I'm going to be the doctor. My name is Zach, and this is my patient.
Hi, I'm Albina.
And before we start, I'm just going to inform everyone about the equipment you need. So first, one of the most important things you need is the stethoscope. And here's the stethoscope. And then we're going to have the blood pressure cuff here. And then the sphygmomanometer that we will measure the blood pressure with in millimeters of mercury, okay? And then I have the heart model here just to have a visual of exactly what we're measuring. So we're measuring systolic and diastolic blood pressure. The higher number systolic blood pressure is going to measure when the heart contracts and from the left ventricle of the heart, it pushes blood into the aorta. When that is happening, we're measuring the systolic blood pressure. And in between beats, when the heart is relaxing and the semilunar valves close, that's going to be the diastolic pressure, the lower number, okay? So before we start, I'm just going to get consent from the patient. May I take your blood pressure? Yes. Okay, and then we're going to practice good hand hygiene. We have hand sanitizer here, so we're going to put that on.
Thank you.
And in an ideal situation, we would also put on gloves. We don't have gloves here today, but just pretend we put them on, okay? All right, and then first we want to make sure the patient is in a good seated position, and also that they're comfortable, they haven't just been running around or anything like that. It's especially important that they don't have their legs crossed, as that can interfere with the reading. And also something you may want to keep in mind is if the patient has a limb precaution, such as they've had a mastectomy or something like that on one side of their body, you don't want to put the blood pressure cuff on that side. And oftentimes in the hospital, patients will have a wristband that says limb precautions, so always be on the lookout for that if they have that. Okay, so first to put the stethoscope in, we want to make sure that these earpieces are going inward like this when you put them in, even though that might feel a little bit weird. And then I want to ask you, we can also ask the patient, have you had a blood pressure reading recently?
I have, yes.
Okay, so we can keep that in mind, and in an ideal situation, we would palpate the brachial artery to find the pulse, and then pump up the blood pressure cuff until we don't hear the pulse anymore, and then do, afterwards, pump it up to 30 millimeters of mercury past that. But since we have a reading on what her blood pressure usually is, we could just do 30 millimeters of mercury past that number. Okay. So let's put the blood pressure cuff on and make sure it has direct contact with the skin. And then there's going to be an arrow that says artery, and we want to make sure that that is above the brachial artery. It's going to be on the inside of the elbow, a little bit above that. So we make sure that that's in the right place. And then we're going to put the bigger side of the stethoscope called the diaphragm. We're going to be using that. The other side is called the bell, okay? But we're going to put the diaphragm
right where the brachial artery is, snug underneath the cuff like that. We're going to put this here so we can see the measurement, okay? And so the first thump that we hear is going to be the systolic blood pressure when we're letting the air out of the cuff. So first we want to make sure that this knob is all the way to the right, so it's closed. And we're going to pump up the blood pressure cuff with air. The first thump we hear is this systolic blood pressure. And then as we're letting the air out of the cuff by bringing this knob to the left slowly, the last number that we hear, the last thump that we hear, that number is going to be the diastolic pressure, okay? So let's pump up the cuff to about 140, 30 above. And then we're going to slowly let the air out. Okay, so I got about 116/64, which is a really good reading. So here I have a close-up, a little bit better view of the sphygmomanometer, so you can see more clearly what's going on. So we're going to pump up again. The patient's blood pressure is usually, systolic blood pressure is usually 110, so we're going to pump up the cuff to about 140. And then at that point, we're going to slowly let the air out, listening for the thumping noises. Okay, yeah, so this time it was about 116/62, so almost the same reading. I hope you guys could see that a bit better. Thank you so much for watching. Thank you guys so much for watching this video. I hope it was helpful and informative.